And we're up and running. Hello, everybody, and welcome to the Arts, AV, and Communication session for the GPS for Success Virtual Career Fair.
Human Services.
Oh, Human Services, just kidding. What? Wait a minute. Let's try that again. I opened up the wrong thing. See, I'm more prepared than you think I am. But I did this yesterday. Human Services. Click on that. That's not the right one. All right, of course, I'm not a circus. For those of you that don't know me, I'm usually not a circus like this. GPS, AA, moderator speech. Oh, for crying out loud, give me 2 seconds. Give me just 2 seconds because we're gonna have to nothing ever works for me. Celeste, I'm really gonna be okay at this. Give me.
No worries.
Those students that are on, we're going to get to a great session in like a minute. Just here.
So this is Eli from Jefferson Lewis BOCES. I'm going to interrupt for just a second as Mark gets some of the documents up for this session. One of the great things about video sessions is you save all that time from traveling so you can spend it, doing things like this. It's also one of the great things about everybody kind of learning new ways of working. Things are changing, and what I've seen from a technical perspective is that everybody has more patience than ever for technology getting in the way. And I do want to thank Mark for volunteering to be one of the moderators. It does take a lot in today's events to be able to get these things to work smoothly. And what I'll say from seeing hundreds of them over the last couple of days, I don't know that any of them have worked smoothly. With that, I'll turn it over to Mark and we can get started.
Yeah, so let's try that again. I've already said hello, and I'm welcoming you to the Human Services session of the GPS for Success Virtual Career Fair. This event was made possible through the hard work, dedication, and collaboration of WPVS, Jefferson Lewis, and St. Lawrence Lewis BOCES, The Workplace, the Watertown Chamber of Commerce, Jefferson County Economic Development, and through the support of the Northern New York Community Foundation and Afcratech, makers of Aminomax. A very special thanks to Jefferson Lewis BOCES for making this virtual career fair a reality. We are so happy that you could join us today. My name is Mark Taylor, and I'm the principal at Case Middle School here in Watertown, New York. I will be your moderator for this session. I'm here to make sure everything runs as smoothly, good one, as possible. Your panelists for today's session are Aaron Fazio from the Victims Assistance Center, Jeremiah Pepino, Volunteer Transportation Center, April Bennett, Cornell Cooperative Extension Association of Jefferson County, Michelle Guffel, JCC, Danielle Holland, Credo Community Center of the Treatment of for the Treatment of Addictions Incorporated, and Michelle Matthews from the United Helpers. Here's how the session will work. Each panelist will be sharing different career options and possibilities in the Human Services cluster, as well as some interesting facts about their industry that they think you should know. Make sure you're paying attention in case you have a question. Once the panelist is finished, we will have a short question and answer session before moving on to the next panelist. You can ask questions about the presentation using the Q&A panel. All you need to do is open the Q&A panel, type in your question, and send it. You can do this during or after the presentation. Please know if you type a question during a panelist presentation, it will not be answered until the end of their presentation. You can also raise your hand during a presentation if the question you would like to ask is better asked verbally. Now, to raise your hand, look at the bottom of your screen, click the button with the 3 little dots. You will see an option that will let you raise your hand. If you have a question you would like to ask verbally, please be respectful. The moderator will then unmute you and you can ask your question. After you've met all our panelists and the session ends, make sure to check out mygpsforsuccess.com to learn more about the 16 different career clusters. So without further ado, it's time to get started, and I would like to introduce you to Erin Fazio from the Victims Assistance Center. Erin, take it away.
Okay, thank you so much. Again, my name is Erin Fazio from the Victims Assistance Center. I am the Director of Outreach. So my job is to go out in the community and educate the public about our agency and our various programs. So today I'm going to, how do I share my screen?
Mark, you're gonna need to move that little ball by currently Michelle's name and put it on Erin's name, or right click and make Erin a presenter. So Mark, if you right click on Erin's name, there you go, you got it.
Okay.
Sorry about that. Okay.
Okay. Can everyone see that? The flow chart? Okay. So as you can see, we have many, many different programs. We employ over 30 employees, plus we have numerous amounts of volunteers and interns that help with our day-to-day operations. So the Victims Assistance Center is essentially our parent agency. Below it, I'm going to start with the Child Advocacy Center in the middle. So the Child Advocacy Center has programs within itself. The goal of the Child Advocacy Center is to work with a team of law enforcement officers, caseworkers, prosecutors to help investigate cases of child abuse. We have forensic interviewing, where they conduct a sensitive, neutral interview of a child, and they are trained professionals that conduct these interviews. Along with that, we have our Child Advocacy Center mobile office. If anyone's ever driven by our agency, you may have seen these large white RVs in our parking lot. We have one that's shared between Jefferson and Lewis County, and one that's in our St. Lawrence County. So essentially, those units, we can dispatch our team to go essentially to families where they have barriers where they can't get to our office. We also have a child fatality review team, where we review cases of child fatalities in all 3 counties, just to see what could have been done to prevent that particular child fatality. We do medical exams for children in our office. They're non-acute medical exams, so they're not invasive for the child. We can do lab testing for the child. Those are done in our office 1 day a week, and we have medical providers that come from Samaritan Medical Center to conduct those medical exams. What we have at the Child Advocacy Center and also at the Victims Assistance Center are the 3 right here. We have case managers. Those are similar to the advocacy part of our programs, where we offer assistance to families, give them access to various services. We can help them file petitions for custody, stay away orders of protection. We can help them file for those in the court system. And we can also attend a court hearing with the family as well. We also offer mental health services for children and adults. Those are specialized trauma-focused therapy services designed to meet the unique needs of the adults and the children for the non-offending caregivers. I should mention that all of these services that we provide are free of charge. Under the Victims Assistance Center, we have a shelter in Jefferson County. It is in a non-disclosed location. It's an emergency shelter for all victims of domestic violence, so men, women, children. We also provide homeless housing for women and children based on very economic guidelines. We have response team advocates. They essentially respond with law enforcement on scene to a domestic violence situation. We can offer support to the victim in that situation and also ongoing support as well, even after the situation occurs. We have advocates that are trained in our Prison Rape Elimination Act. Basically, we have a hotline where prisoners can call and we can offer experienced sexual assault and sexual abuse, their experience in the sexual harassment portion of the prison, essentially. Another program is our Safe Harbor program, where we help youth victims that are trafficked in our community. That is also in the Tri-County region, St. Lawrence, Lewis, and Jefferson County. We can offer the services to high-risk youth as well. One of our newer programs, we do have an on-site attorney that provides legal assistance to all of our clients. Another advocate position that we have an advocate that's at the Jefferson Community College. She spends part of her time at the college assisting all the students on campus, and then part of her time at our main office. We do have the Sexual Assault Nurse Examiner program. We contract with registered nurses or higher medical professionals that are trained to collect forensic evidence in cases of sexual assault. We work with Samaritan Medical Center, River Hospital, Carthage Hospital, and shortly we'll be working with Lewis County General Hospital for that program. I mentioned earlier, we have the volunteers and interns as a part of our agency. We rely on them a lot to go into the hospitals to advocate for our sexual assault victims. And we also have a lot of volunteers that come into our office just to assist with everyday operations and office duties. We also have an advocate that helps with the Elder Abuse Initiative. We basically educate the community and our older populations about domestic violence and all the resources that are available to them. And then another one of our newer programs is a coordinated entry person. She works closely with Department of Social Services and helps coordinate the homeless housing for, again, the Tri-County area. That's pretty much a quick brief overview of what we do at our agency. I don't know if anybody has any questions of our day-to-day operation.
So Erin, there's a couple questions from Lemon, who says she wants to work with special victims units. What steps would I take to work towards that? And how old do you have to be to volunteer or to be an intern?
So we work with interns that are at bachelor, associates, bachelor, master levels. We have various intern positions. Some are with with the mental health professionals. Some are one is in finance. Others are with the advocates that we have in our agency. They can certainly contact me to set up something like that. They do have to go through a 40-hour training, background check, and fingerprinting as well. The same thing for volunteers. So I don't know if that's specific to special victims units. Not sure what they meant by that.
Lemon, is that clarified? Do you have more insight you can give us as to what you're looking for? Maybe Lemon's good. Could be. All right, are there any other questions for Erin? I don't think so.
Oh, how old do you have to be? We ask that, I believe for the volunteers, you're at least 18 years old. Interns, same thing, as long as you're working towards an associate's or higher.
Okay, I think that's about it. Erin, thank you very much for sharing. You got a lot of great information. Boy, a lot going on there, that's for sure. Next, we have Jeremiah Pepino from the Volunteer Transportation Center. And let's see if I can get him to be the host, however that works. Click on his name.
If you right click and make him a presenter, that should be great.
I think he's a presenter. The ball's by his box now.
Perfect.
Are you all set, buddy?
Okay, I am. Can everybody hear me all right?
Sounds good. Thank you.
Excellent, thank you. Yes, I am, as Mark said, I'm Jeremiah Papana. I am the Foundation Director for the Volunteer Transportation Center, and I'm also going to attempt to share my screen, so let's try that. Looks like it is disabled for me. I may not be the host. I think the ball is still on Aaron.
How about try that?
There we go. That looks great. Perfect. So I will share my screen. Bear with me here. Let's see. Let's do this. Okay. So can everybody see the PowerPoint in front of you?
Looks good.
Okay. So getting to know the Volunteer Transportation Center. So we at the VTC, our mission is to provide, as you see on the screen, to provide transportation to health, wellness, and critical needs destinations utilizing volunteers and mobility management for anyone who has barriers to transportation. So we're a 501c3 nonprofit organization. We're based here in Watertown, comprised of staff, volunteer drivers, boards of directors, in order to accomplish our mission. And what we'd love to see one day is a community where one day transportation is readily available to everyone. Our leadership consists of Sam Purrington, who is our executive director. I am also on the leadership team as the foundation director and also communications director. And we also have a full management team that oversees our programs as well. We have two different entities. We have the Volunteer Transportation Center's board of directors, as you'll see on the screen. And we've recently established our own foundation board. So it's a separate entity meant to be the stewards of any donations and whatnot that come into the organization to help us with providing the services that we do for the communities. What we do? Well, we strive to improve health and wellness. So that's every nonprofit in the community really has a different piece of the puzzle, and we all strive not to duplicate services. Our portion is transportation. So we look to help people in the community who are really, as we said earlier, facing those barriers of transportation. And a lot of times it can be, a regular routine medical or dental visit. It could be something a little bit more serious, a little bit more, demanding on the person's time and the ability to get to their appointments, such as chemotherapy for those going through cancer or dialysis, those having kidney issues, and also even something as simple as going grocery shopping at least once a month. That's something that, many of us might take for granted. You hop into the car, go to the store. That's not always an option for people. So we're here to help with that as well. How do we do it? We do this through a really strong core of dedicated volunteer drivers. So we service primarily the St. Lawrence, or Jefferson, and Lewis County area, so the Tri-County area. So 350 volunteer drivers. Now, that's not at any one given time necessarily. We have some drivers, being that they're all volunteers, and many of them are retired. It depends. In the wintertime, we have a lot of, as we call them, snowbirds who go to Florida or point south when where it's a little warmer. And so our core group of volunteers, is diminished a little bit. And, of course, during this time with COVID-19, we also see, a lesser number of volunteer drivers. And volunteer drivers are not paid, but they do receive mileage reimbursement for the miles they drive. So you could be a volunteer driver who simply wants to just drive for the heck of it, take people back and forth to appointments and whatnot. But, there is the option to also receive mileage reimbursement because you are utilizing your own vehicle and your own gas. And so, there's always wear and tear in vehicles. So mileage reimbursement, as you'll see as you enter any career field that requires driving, is typically the case where you'll get reimbursement. Our service area, like I alluded to earlier, is we primarily serve, the Jefferson, Lewis, St. Lawrence County areas, but we also have programs in other areas of New York State as well, including Erie and Genesee counties. We also have contracts in the state of New Hampshire and California as well. So we have have services out there. Our history, we started back in the 90s as the Volunteer Center of Jefferson County, and we were incorporated as a traditional volunteer center working with United Way, which is now known as United Way of Northern New York. And shortly after, there was a request from the Office for the Aging to establish a transportation program because that was seen to be one of the most prevalent needs in our region. So we moved forward with having that being our sole focus. And as of January 96, that is where we went, with the Volunteer Transportation Center Incorporated. As you'll see on the timeline here, again, it talks about just a kind of a snapshot of the where we were and where we are today. We have various programs along the way, contracts, things like that in order to help fund us. We have started providing wheelchair accessible vehicles in Jefferson County through a grant we received back in 2017, so that was a big boom. And as I mentioned earlier, you know, the volunteer drivers drive their own vehicles, but there is the option if they'd rather drive a VTC vehicle. We have a few of those here. We don't provide mileage reimbursement for that because that would be our vehicle that they would be driving, but it is an opportunity for them to, for somebody who maybe they don't want to drive their own vehicle, but they want to help out however they can. That's, you know, definitely an option. Looking at the numbers. So last year alone, our volunteer drivers provided more than 30,000 charitable trips to different destinations throughout the Tri-County area. They drove 424,000 plus miles to help people in Jefferson County, 141,000 plus miles in Lewis County, and 386 miles rather in St. Lawrence County. Excuse me. That's driving a grand total of 262,000 hours on the road. So if you look at that, that's 912,866 miles in the Tri-County area, which actually is an increase over miles driven in 2018. You know, just shy of 20% increase, which is huge. Examples of trips that shows exactly what we do. If somebody needs to go to a primary care visit, if somebody needs to go to physical therapy, and a lot of these different appointments are not just a one-time deal. You know, like I said, chemotherapy, physical therapy, drug and alcohol treatment, which we work with organizations to provide transportation to those appointments as well. It can add up really quickly. How much is that? So you look at the 912,000 plus miles, you multiply that by the mileage reimbursement that we provide, which is, you know, charitable rate is 44.5 cents a mile. That comes out to $406,000 that we provide in mileage reimbursement, or we did in 2019. It's great, you know, but how do we raise the money in order to pay for that? Well, we have contracts, we have grants, we send out mailings once a year. And there's endowments. People leave money for us in their estates. We also have fundraisers, which obviously right now is a very difficult time. Makes it very tough to do something like that. We had just had our last fundraiser, which is the North Country Chili Cook-Off back in February, prior to COVID really becoming a widespread issue. Normally we would have the Posh Purse Palooza, which is a purse auction we do in Watertown. We also have a golf tournament, a couple of them actually, one up in St. Lawrence, one in Lewis County to help benefit Jefferson Lewis services. We have a trap shoot. We have a cook-off, mac and cheese cook-off in Potsdam that we started last year, and a bowling fundraiser. So all these are great events. You know, we raised quite a good bit of money for these in order to provide the services that we have. And just a quick snapshot, I mean, it'll show you the North Country Chili Cook-Off, where the money is benefiting veterans, rides for veterans and their families. We can raise $35,000 from that, and that helps fund 70,000 miles. Because again, based off of the rate that we provide for reimbursement, that's the equivalent. We always say, you know, for every dollar you raise, we can provide 2 miles of transportation. So it just gives you kind of a snapshot of, you know, the amount of money that we can raise, and it can be up, it can be down, it depends on attendance and whatnot. But last year we were able to generate more than $72,000 based off of the fundraisers we had. And that helped provide 144,000 plus miles of mileage for our clients. How to become a driver? You can visit our website, and I, definitely, would encourage you to check out our website, volunteertransportationcenter.org, to become a driver. I know you guys are not exactly the driving age, but if you are interested when you do become of driving age, and 18 plus is what we have for our drivers. Also, if you have any family members who are interested, maybe you have somebody who has a little extra time on their hands, maybe they're retired, you can check out this information on our website. And all of our drivers are, they have to go through a very extensive criminal background check, as well as review of the driving records. And we go through rigorous training. And if you want to become a client, if you or somebody you know has a family member who wants to receive services, you can reach out to us, again, through the website, give us a call, and we work with the Office of the Aging in each county to make sure that the clients not only get the transportation they need, but if there are other services, we work constantly with other organizations and nonprofits to make sure that there's a holistic approach. If we find that there's somebody that might have some issues, maybe like when it comes to Victims Assistance Center, if we learn of some sort of issue where it becomes there's a potential abuse issue, we reach out or we encourage them to reach out to the organizations that provide those services to make sure that they're getting all the care that they need. And if somebody has if an applicant has access to public transportation, we always work to get them involved in that as well, because we would like to, utilize systems that are already in place and not duplicate services. And that is about it. So I will stop sharing my screen, I think. But does anybody have any questions?
I'm not seeing any questions in the chat. Let's see if there's any hands raised or anything.
Aaron was a tough act to follow there, so I hope I did okay.
You did awesome. I'm listening to a lot of this stuff, and I want all my Case Middle School students to hear this stuff, because this is a lot of great information to get them to just start thinking about, career paths and whatnot. I love it. I'm glad that I'm here.
Same here.
Without that, I think it's time to move on to my friend April. Appreciate it. April Bennett.
Thank you very much.
Right. Thank you, Mark.
And
if you make me the presenter, then I'll start sharing my screen.
I'm going to click on the little ball, right? Where do I click? For crying out loud.
If you go to their name and right click, and it's going to say change a role, and then you can make them the presenter, or you can drag the little ball. You got to drag it though.
Right there. Oh, I click on her name. All right. See, by like the 4th or 5th, I'll get it right. All right, April, I think you're in.
I think so. Okay, can you guys see my screen?
Yes, looks good.
Perfect. Okay, so I am April Bennett. I am Nutrition Program Manager at Cornell Cooperative Extension. So I thought I would start off just by giving you a little bit of background about Cornell Cooperative Extension, because we are a large agency and we've been around for over 100 years. But a lot of times you may have heard of some of our programming, but you may not realize that it came from Cooperative Extension. So what is Cornell Cooperative Extension? It actually all started with President Abraham Lincoln. And in 1862, President Lincoln signed 3 acts. So first created the U.S. Department of Agriculture, known as the USDA, and the National Institute of Food and Agriculture. He then enacted the Homestead Act and the land grant legislation. So basically, a land grant university is an agreement with the government. And we have a land grant university here in New York State, which is Cornell University. Right. So the Hatch Act provided federal funding for agriculture research that established between the USDA and our land grant colleges. So that's how the extension system all got started. And there's actually an extension in every single state in the US. And so there could be multiple offices here in New York State. There are quite a few throughout every county. In different states, there are different numbers of extension offices, but they're all tied back to a land grant university, and they do exist in every single state. So here in New York State, as I mentioned, our connection is with Cornell University. And that connection started in 1865. And CCE here in Jefferson County has been operating for over 100 years. And our programming has changed quite a bit over those years. but our mission has stayed the same. So we basically take research-based information that's generated at the university, and then we bring it out into the community. So we provide that education. We also, in doing the education that we do across our work, we often collect a lot of information that then gets put into research at Cornell University. So it's a great partnership that brings a lot of resources to the community, but also provides a lot of information that gets turned into very important research that shapes a lot of the healthy behaviors that we are trying to encourage. So these are some of the program areas that we cover. And these are some of the ways that you may have encountered cooperative extension. So agriculture, we do a lot to help farmers with developing a business model, with all sorts of things, providing workshops on ways that they can be more efficient, helping them get access to different technologies that they might need. And then we also do quite a bit of research in agriculture. Community development, Fort Drum and military support. We have about 1/3 of our staff is actually based out at Fort Drum typically. And our staff is over 100 staff people. I think we have 117 staff people right now. That number tends to change from year to year because most of our programming is grant funded. And so the programming does tend to change a bit, but we're typically just over 100 staff people. And as I said, about 1/3 of those are out at Fort Drum supporting military families. Nutrition and health is the department that I work in. I'm going to talk a little bit more about that one today. And so we work to help make sure that people know what it means to make healthy choices. What are some of those evidence-based behaviors that we can encourage? So not just the stuff that you might see on Facebook or that you might hear from friends and family or any fad diets. We share what research is actually showing that really is going to impact our long-term health. So we get that information out to the community so that they can be educated to make choices and feel empowered to make good choices. We also have a parenting department, so we provide a lot of parenting education and resources. Some of that comes through a partnership with the Department of Social Services. So if there are open cases through DSS, they can be referred to our agency to receive some parenting education as part of their case plan. But we also have other parenting programs that's just open to anyone in the community. We hold different workshops and different events just to try to support parents' needs and help reduce stress in the home. And then our 4-H program, which is all about youth development. So we have a 4-H program right in our office. So anybody throughout Jefferson County can become, any youth can become part of 4-H, anyone between the ages of 5 and 18. But we also have a very large number of after-school programs. I believe before COVID, we had 16 different after-school programs across the county that were running programming. And that programming, so when you think of 4-H, or when I used to think of 4-H, I would think of about like learning how to take care of animals and bring them to the county fair. And that's a very big part of what we still do. But our 4-H program now is doing everything from all different sorts of STEM activities. They're learning about coding and robotics. Here in Watertown, we recently had a 4-H group that developed an experiment that was taken to the International Space Station and tested in space. So 4-H has come a very long way. All right. So this is our mission and vision statement. And so basically what I mentioned to you before, we're all about education. So we educate kids, families, farmers, and basically the whole community. And all of our education is research-based knowledge. And it's things that, that are practical that really help us just have a better life and connect us to resources to enrich our lives. Okay, so I'm going to tell you a little bit more about my department, which is the nutrition department. So this is kind of the heart of our department here. So a big portion of what we do are whole cooking and nutrition classes. We do some classes for children, so they might take place in schools, they might take place in after-school programs or with summer camps, any place where we can get a group of kids together and meet with them on a regular basis to help them learn at an early age some easy ways that they can take some healthy steps. We also do nutrition and cooking classes with parents. So if they are a caregiver and any sort of a caregiver, we want to help them so they can be great role models for those kids and either start early before there are maybe any challenges in the home, or if maybe they have been already realizing that there's something that they want to try to change and do some goal setting, and we can help them with that, and we'll work with the whole family. And then we also do nutrition classes primarily for people who qualify for SNAP Ed benefits. So we want to help people who have limited food resources to be able to stretch their food dollars and to be able to make the healthiest choices possible for themselves and for their families. In addition to cooking and nutrition classes, we also work on something called environmental change efforts. I'm going to show you a little bit more about each of these, but we help organizations think about ways that they can reshape their environment to make it easier for people to put all this education into practice. We also provide access to a lot of recipes that would model all of those things that we're teaching in class. So they would include recipes that are inexpensive, easy to prepare, and use healthy ingredients that are going to help people make those long-term changes. Probably the first thing that anybody can do to support healthy nutrition across a lifetime is breastfeeding. So we devote a lot of energy to breastfeeding support. We have one educator on our staff, and that is her primary mission, is to be that support. So she's a certified lactation consultant, and she can meet with moms even before they deliver their baby or afterwards if they have any questions or they're wondering if breastfeeding is the right choice for them. She can help to give them that, again, research-based information. And then if they're having any trouble with breastfeeding, she can provide all of that technical support in order to make them successful so that they can continue to breastfeed, ideally for at least 6 months to a year, or until they would like to stop. And in addition to what we do in person, we also have a lot of resources logged on our website. So we have, especially in this day and age, recently we've beefed up our video resources. So we have all sorts of videos that will walk you through how to prepare some of these recipes, that will teach you some simple ways to be active at home, and connect you to some other ways to be healthy. Not just at home, but also at work. Worksite wellness is a big mission of ours, and it's part of those environmental change efforts. So we can help organizations start a wellness committee or think about ways that they can take good care of their employees. And recently we've been talking a lot about how to extend worksite wellness into working remotely from home. So we've been collecting and developing resources for that. And again, a big focus of our organization is with youth, so youth nutrition and wellness. So we have really strong partnerships with all of our local school districts, as well as many community agencies, so that we can provide whatever resources they may need in order to deliver that same message of nutrition and wellness. All right. So what do our cooking classes look like? These are some of the things that people will learn if they take our classes. So again, healthy, low-cost meal ideas. We want to make sure it's really simple, so things that everybody can feel really confident that they can do. We know that it's not just about changing our food habits, so also helping people be more physically active, teaching them how to be good shoppers. So we'll teach people how to read unit prices in the grocery store, how they can compare prices to make sure they're getting the best value for their money, how to read nutrition facts labels, and just how to shop smartly. And then once they get that food home, how to make sure they can prepare it safely. And then connecting them to any other resources in the community so that they can have access to the best quality food for themselves and their families. Our nutrition program is basically funded by 2 different federal grants. So we have the Expanded Food and Nutrition Education Program, which has been going on for just over 50 years. And we have the SNAP Ed program that I mentioned before. So both of these programs work together to allow us to work with the largest amount of the community possible, with a primary focus for both of these grants on low-income families. So targeting people who need our help the most to make sure that they have access to all of the resources available. And both of these programs cover both kids and adults. So that's how we are able to provide all of these free classes. Those environmental change efforts that I mentioned before, so there's a lot of research and new emerging research that's also showing that people are more likely to be healthy when they have an environment that supports those healthy changes. So, for example, if we're teaching people that they should be drinking water and less soda or sugary beverages, but then they go to work or to school and they don't have any access to water throughout the day, it's going to be really hard for them to keep up that healthy behavior. So we would work with schools and organizations to make sure that they have drinking fountains or water bottle filling stations or water coolers, or that they have a policy so that kids would be allowed to have a water bottle in the classroom or be able to have access to a drinking fountain. So those are just a couple of examples of how we would work on those environmental change efforts. But there's many, many other examples of how different organizations can either think about policy changes or actually making some changes to the physical environment to make it easier to support those healthy behaviors. I told you breastfeeding support, these are some of the things that we would provide education or technical assistance on. So for a lot of moms, they may have trouble with latch and position after they deliver, so they might not think that they're able to breastfeed, but over 80% of the time with a breastfeeding educator's help, they can actually fix that latch or that position to be able to be successful. And they may not be aware of what some of the New York State or federal laws are around breastfeeding, so we can educate them about that so that they understand what their rights are out in the community as well as in the workplace. So since we started working remotely in March, our programming hasn't changed at all. So all the things that I've been talking to you about, we're still doing, but we've had to really think about how to do them in a new way. So all of our education is now happening virtually. We've all learned a ton. So these are just some of the examples of ways that we're still connecting with the community. In addition to our office phone number, we developed a helpline phone number that will go directly to, actually goes directly to me, and then I can get those questions answered. So that way we don't have to worry about phone calls being forwarded from the office since we don't have a receptionist in the office right now. We've also developed a weekly newsletter that's going out to area schools and nonprofits, and it's reaching about 3,000 households every week right now. We've enhanced our website, so there's lots of new resources available there and connection to other community agencies. We have a Facebook page, which is really active, and a YouTube channel, and our YouTube channel is where we house all of our videos. And we have now learned not only how to do our classes over Zoom, both one-on-one or in groups, but we can actually stream them to Facebook Live. So we have quite a bit of programming that's happening live right over Facebook. And we also have recorded lessons and videos. So if somebody can't make the times that we're holding programming, but they really want the information, they can go back. There's links so that they can watch the lesson or they can see a video. And a lot of times, if they fill out a brief survey and they qualify, they can even get an incentive mailed to them for participating in those classes, even if they weren't able to do it. So, of course, I'm pretty proud of our nutrition program, but we have a lot of other great programs that I've talked about through Cooperative Extension. And so these are some of the other programs that you might have encountered out in the community. So I mentioned 4-H. We also have the Master Gardener program, which supports a lot of community gardens, including the Urban Mission Garden, which is our largest community garden that provides produce to local food pantries. We also run 4-H Camp Wabasso, and we facilitate Adopting Healthy Habits, which is where a lot of those environmental efforts are housed. And this is our information about where we're located. This is under typical circumstances when our office is open. Right now, there's only a limited amount of staff that are actually in the office. Most of our educators are still working remotely, but we are still available through email, and through our website, and through our Facebook page. And I did put our volunteer coordinator on here. So we do accept quite a few volunteers and interns. I actually just had an intern that started in March, the first week that we started working remotely. So that was kind of interesting. But even through COVID-19, we had internships. And I coordinate those volunteer positions. So if anybody has any questions about that. And that's it for cooperative extension. What questions does anyone have for me? I'm gonna stop sharing my screen.
I don't know about you other panelists, but I loved going to 4-H camp when I was little. It was an awesome place to be, and I know that Cornell and April has done a lot for me at Ohio and in a lot of different places. So thank you to you working there. There's lots of neat things going on in this community, that's for sure. There should be a lot of adults that are hearing these presentations as well. Let me see. I don't think we have any questions. Thank you very much, April. We're going to just move on. You're welcome. Good to see you.
You too.
All right. Maybe fifth time's a charm. I'm going to introduce Michelle Gaffel from JCC, SUNY Jefferson, and let's see if I can make her. Oh, look at this. Watch this. No one is even telling me what to do. Michelle, you are on.
Thank you, Mark. Thanks, everyone. Hi, students. I am Michelle Gaffel. I am the Director of Career Services at Jefferson Community College, which is your community's college. JCC is part of the State University of New York Career Development organization, and we are one of 30 community colleges in the whole state university system. There are 64 institutions within SUNY. So I am today representing just specifically the Career Services Department at Jefferson. We have over 45 academic programs of study, and each of those programs are within 3 academic divisions, which are overseen by an associate vice president that then reports to the academic dean and the president. And my department in career services is one of the what's called the student professional service departments as part of our student success division, or the non-academic divisions at the college. I am a one-person office, and so my job as director of career services is kind of threefold. Hopefully it's going to help you as you look at careers and opportunities for your life. That's my primary job as a professional counselor, is to help students of all ages, from traditional 16 to 21-year-olds to 22 to 90-year-olds, learn side by side in an exciting environment in education, in higher education, to help them discover what their passion is. But in addition to being a professional counselor, I also teach classes, and I also direct and manage my department. So I do a lot of marketing and public relations, and a variety of other types of skills that come along with it. So with that, I will share my screen, if I may. Here we go. Okay, so again, in terms of higher education, if you are interested in a position like mine as a professional counselor, and one where you are a director of a department, you must have a minimum of a master's degree. My degree is in educational psychology and counseling. My bachelor's degree was in public relations and journalism. So when I was thinking about what I wanted to do, I loved writing. I enjoyed marketing and public relations. So I do get out into the community quite a bit. I work with a lot of local, regional, and national employers, other human service agencies, and other businesses and organizations. So I have to have that bachelor's background, that writing, that public relations, that marketing background in order to do my job. But when I do my one-on-one counseling with students, I need to have that background in psychology, and specifically for me, in educational psychology and in counseling. So that's kind of where we started, where I started. I always use this quote from Socrates because when I'm working with students, and as I'm telling you now, as you're trying to research the kinds of occupations you may be interested in and the types of career sectors you'd like to be working in, don't procrastinate. Move yourselves first. If you want to move the world and learn more about your passions, Socrates always says, move yourself first, which means that you have to look intrinsically at who you are. If we look at the paradigm that I use in career and academic planning, it's really where you would learn about yourself. You look at your passions, your values, your lifestyle, your interests, your skills. How much education do you want to pursue? Really learn about who you are, what you like, what you need, what you want, what you don't like, what you don't like, need or don't want. And then you assess the options. You research what a career services director does. You research what a registered nurse does. You research what a school principal does. And then you test the possibilities. You perhaps engage in a job shadowing or an informational interview. And then always have plan B. So if plan A doesn't work out, you start all over again. So part of my job as a professional career counselor is working with you to assess where you're at, helping you find the opportunities. So I might work with Mr. Taylor and say, hey, Mr. Taylor, would you like to sponsor a student who'd like to do a job shadow and learn more about what you do in your profession? And I set those opportunities up for students. Then we talk about those opportunities. I might counsel them on what the pros and cons are of those possibilities. So that's one activity that's part of that career planning model. Here's at a glance what I do on a day-to-day basis. I do all kinds of personalized career counseling. So I might have 2 or 3 hour-and-a-half long sessions just where I'm sitting and talking with students one-on-one, or perhaps I'm doing a group session, but we're talking about what they need and what they want. I might be talking to them about a career or personality inventory. I would administer an inventory, which is not a test. It doesn't look at your aptitude, but it looks at your career interests and your personality and helps define what types of occupations might be good matches for you. And then I would interpret that assessment. Depending on what kind of an assessment it is, it might have a variety of different grids that talk about how your personality does or doesn't match certain occupations, where your greatest interests were, and what types of career fields would be best suited for you. I do all kinds of class, club, and community presentations every day. I usually go into classes like nursing, zoo technology, criminal justice, education, human services, accounting, computer science. And I might help those students write a cover letter or a resume specifically to help them market themselves in that profession. I might go in and engage in a career inventory. I might administer an inventory right in the class for those students so they can make sure they're in the right program of study. I might go into a class like the Criminal Justice Club, and I might work with our police agencies in helping them learn more about those shadowing programs. I do all kinds of workshops on the skills that are needed in your profession, or again, how to write a resume, or how to do a professional interview. We have on-campus employment. So I coordinate the on-campus and the off-campus student employment programs. So if a student needs to help pay for college and they want to work on campus in the library or in phys ed, I'll work with those campus supervisors to help hire the students. I'll work with the students to help them apply for their jobs. And I'll help them write the resume so they're marketable and competitive for those jobs. I coordinate a job shadowing program called Sharing Knowledge, Shaping Futures. And that again is where I work with local employers who would like to mentor our students. I also do mock interviews every day with students. So we come in, we sit down, and we actually engage and practice interviewing so that when students go out, whether it's for an internship, whether it's for going to the next level of their education and they're interviewing at another college or university, or whether they're interviewing for their first job out of college, I help with mock interviews. I also coordinate all of the campus recruitment for military members and employers. So we bring Renzi Food Service, Samaritan Medical Center, IBM. We bring these wonderful organizations to campus to interview our upcoming graduates so they have an opportunity to see what kind of hiring practices there are. And I also coordinate all of our career and employment fairs and host a variety of my colleagues from other institutions, and we share resources so that we can learn best practices on how to help students. So that's a day-to-day for me. It's great. You start with a few career counseling appointments, then you're in class teaching, and then you're out in the community giving a presentation, you're working with an employer, you're helping with orientation, Fall Fest, whatever there is that's happening on campus, and there is a lot happening on campus. It's very vibrant, energetic, diverse, and very fun. If we look at what career counseling is specifically, it's not just helping a student identify their passion and figure out what occupation they want to go into. What we find, it's a lot of personal counseling, and that's where that educational and psych comes into play. So students will come to me and say, hey, I want to make $300,000 a year, but I don't know what I need to do to get there. Well, we have to assess, right? What are your passions? What are your interests? What courses do you like to study? I do a lot of academic advising as part of my counseling. If you tell me you want to be a nurse or a doctor, but you hate the sciences, we've got to go to plan B. Perhaps mom and dad are helping you pay for college, perhaps they're not. So again, that's where I'm helping coordinate jobs on campus so you can help pay for your education. You may want to go in to be a teacher, but you have no idea what the trends are in the economy for the next 2, 5, or 10 years in teaching. All right. So I help you look at the labor market and research what occupations are growing, and does that match where you're at? All right. We also look at lifestyle issues. I have students who are coming from families of 4 or 5 kids, and maybe one of them sadly is ill, and all the money for their family is going toward that ill child. So how do I support myself while I go to school? So career counseling is much more than just identifying people's passions and interests. It's looking at the holistic person, where they're at, and what else is involved in the whole process. I can tell you that part of the counseling that we endure with career development and career counseling specifically in career services is the impact of the factors that are the realistic aspects of your life. So fear, procrastination, lack of self-esteem, and uncertainty about the future are 4 inhibitors that really keep students from identifying what career direction they want to go into. So no matter what career field you go into, you want to make sure that you feel good about yourself. You have support systems in place. You aren't fearful. You do some research to identify what the trends are for your profession. All right, and this is what we help with in career development and in career counseling. It's helping you overcome those factors so that you can be better. Health, poor time management skills, financial changes, and issues with your family may inhibit you from being where you want to be. So this piece is a huge piece of helping you identify what it is that you want to do. We do take a holistic look at wellness. So these are the 6 dimensions of wellness. You're the most important person in this direction. All right. You want to make sure you're involved in school, involved in your community, have social aspects of your life that you can put on a resume. You don't have to spend tons of time, but make sure that you're involved in your community and in your school. Make sure you take care of yourselves physically, eat well, sleep well, have a good, healthy mind and body. The occupational dimension is what we're talking about. Assess who you are, what you need, and what occupational goals you have. Knowledge is making sure that you keep up on current events, that you can think critically and solve problems. You don't have to be the brightest and best student to go into a profession of your choice. You have to be marketable. So just know what it takes and work hard to get there. The self concept is making sure that you identify what's important to you. And the spiritual concept is making sure that you understand where you are in the whole life around you. So you want to be balanced. You want to make sure that you're not involved in every social aspect, but you're not paying attention to your grades. You want to make sure that you're balanced so that whatever profession you go into, you've got what it takes. And then you also want to look at what's important in terms of getting where you want to be. So when you think about the skills that I have to have in my profession are counseling skills, marketing skills, teaching skills, critical thinking skills, problem solving skills. Those are what we call hard skills. Those are the technical skills or content specific. They're related directly to what I studied in college and in graduate school. If I want to be a good counselor, I better have a degree in proficient counseling skills. But I also have to have what are called soft skills. Soft skills are our non-technical skills. They're also known as transferable skills. So regardless of what profession you go into, you want to make sure that you can communicate professionally, all right? That's the number one skill that employers are looking for. They want you to be able to think, write, listen, and speak well. Those are your communication skills. But I also have to have, and all of us have to have, excellent organizational skills, time management skills, critical thinking, and problem solving skills. So the hard skills, again, are the skills specific to the profession that you want to go into. You want to be a nurse, you have to know how to give a shot and have nursing skills. You want to be a teacher, you have to know how to teach and devise lesson plans. But you also need those soft skills, okay? All of us need those soft skills. All right. In my profession as a professional counselor and directing a career development program, I also have to know what the recruitment trends are. So I have to write all kinds of reports. I have to do all kinds of labor market research. I have to talk to our faculty and staff. I have to talk to other employers so that I can teach our students what it is to be competitive in the workforce, what it is to be competitive when they transfer from JCC to a bachelor's level school. So you want to spend more time on problem solving and less on memorization. You want to make sure you know the field you want to get into. Anytime you can engage in an internship or a job shadowing or any kind of a volunteer experience is important. Take coursework outside of your field of study. Focus on developing those communication skills. Just help engage and make yourself as competent as you can. Okay? So again, think about what profession you want to go into. Engage with people who are in those professions. If you want to work in higher education like I do in a dynamic, fiercely diverse occupational area, it is so rewarding. Learn more about the opportunities. My area is just one of many departments within the broader scope of higher education. You could go into student development. You could go into academic advisement. You could go into formal teaching. Most positions at a community college and at a public or private college or university do require a master's degree to get started. If you're in a big college or university, which is focused more on research, often you have to have what's called a PhD or a doctoral degree. There are many of our staff, support staff members, like our secretaries, our facilities members, all of the really important people who make the college tick. You can go in with associate's degrees. Some have high school degrees. So higher education like JCC is a fabulous place to get started in a variety of different jobs. So if you'd like to learn more about how to be a professional counselor, specifically in career development or any of what are called our student success departments, please let me know, research us online, and we would be happy to tell you more. Okay, so are there any questions that you might have for me, or higher education, or career development, or counseling in the sector of human services at all?
I don't know. I'm pretty sure I want to go and be a counselor.
Okay, come on, join me, Mark.
I think we'd be quite a team.
We sure would. I'd love it.
I'm not seeing any questions. I'll see you on the river sometime soon, I hope. So thank you
hope
very
so.
much for sharing with us.
Thank you very much.
All right, next up, we've got Danielle Holland from Credo Community Center for the Treatment of Addictions Incorporated. Danielle, and we're gonna do
Hello,
this.
can you hear me?
Wait, don't talk yet. Wait, let me click the button, the ball. Wait. Oh, wait, where'd you go? Where's your ball? Is it up there? Human Services. Oh, see, you go, Danielle. Darn it. Your name. Oh, wait, I found it. Ball. No, ball. All right, you are now you're ready to go. We can hear you. You sound great, and you are the host.
Okay, you can hear me?
Yes, sounds great.
Perfect. Hello, yes, my name's Danielle Holland. I'm an HR generalist, human resource generalist here at Credo Community Center. I also have my HR intern off to the side, Samantha, with me too. So we're gonna just talk to you about Credo, what we do, what we're about, just so you can get a little bit of a better feel for us. So I'm going to share my screen. Can you see the screen okay? All right.
Yes,
So,
looks good.
okay. I tried to look for the head nod mark, but I couldn't see it. All right. So to start off, Credo Community Center is obviously in the human service industry. We are a nonprofit that has been in the business of providing services and treatment for over 40 years in the community here in Jefferson County, as well as Lewis County. So we treat individuals, we help groups, families, adults, adolescents, and children whose lives have been negatively impacted by substance abuse or mental health issues. So this slide here, this is our outpatient facility here in Main Street in Watertown. This is our site that we're mostly known for. Currently, we have 142 staff. So we have a variety of different roles within Credo. As you can see here, we have everything from administrative positions, registered nurses, licensed social workers, residential support staff. Each role is crucial in running Credo. This is a breakdown of our position classifications. As you can see, a lot of our positions are clinical, but it's not all that Credo's about. As I mentioned, we do have a lot of support positions and a lot of positions that help keep the business running. I'll go back one slide. This is our mission statement. We believe in transforming lives through quality treatment. This is our mission statement, you know, as employees, as well as how we treat the individuals that come through our doors. This is another breakdown of just how our company is composed. The darker blue is administrative and the lighter blue is clinical. So that just shows you there are a lot of different positions and a lot of different titles here in the organization. So as I mentioned, we have our Main Street facility, but we also have 7 other locations that are included. So integrated outpatient clinic here in Watertown, Lowville, we have the Women's Intensive Residential Facility. We have 2 community residences here in Watertown, Winthrop and Washington Street. We have our residential services out at the farm, and we have outreach offsite services. I myself actually work in the administrative offices here at St. Anthony's. And as I mentioned, I'm an HR generalist, so I wear several different hats here within the company. And, you know, one of the best parts of working here at Credo is I really think that Credo and, you know, a lot of these companies here that have been in the human service industry that I've presented today really make a difference. Especially for me, I find great pride, and you know, I might be wearing my Credo jacket around town and people will come up to me and talk about how Credo's made a difference in their lives or their friends and families' lives. So it makes me feel like I'm part of something bigger it makes me really connect with, you know, the mission with Kratos. So that's something where I really enjoy working here. I'll quickly go through a little bit more in detail about what we do. So again, this is our outpatient location. We have an opioid treatment clinic there that helps those that need it with medication assisted treatment. This program helps people that need it with methadone, Suboxone, and Vivitrol. You know, this program, some people, you know, when I go to job fairs, and this is one of the more challenging parts of just the substance abuse field, is that you know, people might come up to me in a job fair and challenge maybe the use of medication assisted treatment. This is something that I believe that addiction has, you know, a big stigma in the community, and I think probably, you know, in the country and world in general. But you know, some people don't believe that we should be treating addictions, you know, with medication. But you know, addiction is an actual disease, and you know, I just keep facts, you know, going. Medical assisted treatment has helped many people in the community. It actually helps in some cases to prevent an overdose. So medication assisted treatment is something that's important and something that we are participating in here at Cradle. Like I said, it can be controversial to some people, but you know, as an HR representative, I represent, you know, the facts, and I represent, you know, what we do. Everyone's entitled to their own opinion. But, you know, that's one of the more challenging parts of my role. Here's our Lowville outpatient facility located in Lewis County. This is, you know, one of the rural services that we provide. So it's important. A lot of people that go here, you know, they might not have, there might not be any other services around specifically for addiction. So they can go to the Lowville site. Here's and the next couple slides should be our residential facilities, but I'll just take the time to talk about, you know, what you have to do to be successful in this industry. And I think this is something where, you know, it's tough because, you know, nonprofits, you're not going to be monetarily rich in this field, but, you know, what skills and personality, what kind of interests are you going to need? You're going to need a passion for this field for sure. Like I just mentioned, you're not going to be monetarily rich in this field, but nonprofits are going to make your life richer because, like I said in the beginning, they're really going to make a difference. You're going to feel like you're part of something bigger. You know, having a passion for the field, having a passion for the clients will definitely make you succeed here at Cradle, whether it is in our residences, whether it is at outpatient. You know, additionally, having a good work ethic and being creative are great attributes to have here. Creativity is definitely important in nonprofits because it means thinking outside of the box and being a problem solver. We might not have a ton of funds, but we will try and be creative with those funds and trying to make that dollar stretch. So here's our community residence. As I mentioned, those are our two halfway houses here right in Watertown. We house males age 16 plus there. At the residential sites, what a typical day looks like, you are going to be, you might be helping clients get to appointments. You might be helping them with life skills, preparing clients for vocational education services to help them work towards degrees. These guys are halfway through recovery, but you know, the women's intensive residential facility, you're also doing the same thing. A lot of the ladies have appointments as well. So you're always busy. Every day is something new, and that's pretty much across the agency. I would say every day is something different. Whether, you know, you're here in the administrative building, whether you're here, whether you're there at the residences, it's something new. This is our SY, the farm is what we call it. This is our final residences here on the PowerPoint. I've already mentioned what the day looks like for the residential sites. So we also have our outreach program. They are actually a part of our outpatient facility. So these folks are working out in the community. They're working in these different areas, could be court, could be jail, could be working with other nonprofits in the area like Anchor Recovery, ACR Health. And really, they are just trying to help people and break down barriers. And that's what you'll hear also with nonprofits. You're trying to break down barriers to entry for these clients. So outreach and offsite service is important because we are trying to bring people in that might need some help, and they're really essential for the community. So what we provide in the community, I think I've mentioned a lot of the different things that we provide. On top of this list, we provide Narcan training, which is really crucial because Narcan reverses a potential overdose. So on top of these different opportunities that CRADO provides, we're also providing the Narcan training to the community. We are a nonprofit, as I had mentioned, but we still make money. And as it's mentioned prior, we do fundraisers, we do golf tournaments, that sort of thing. And I'll finish up with saying just, why work for CRADO, why be interested in CRADO. Again, it's integrity and honesty come first here. I really think that anybody that joins this organization is really going to feel at home. They're going to really feel that, you're making a difference. I keep saying that, but it really is. It really feels like, you're a part of something. One of the questions that I had seen on different presentations is how much is a typical salary. So, we have several different ranges here. Basically, starting out at CRADO with you can start out at CRADO with a high school diploma. So you can start here very entry level and figure out if this is the right field for you. And you can start here with us with a high school diploma, and you're going to have a salary around 27,000, 30,000. We have positions requiring associate's degrees, which typically start around 31,000. We love to see people that, go to, JCC for their associates in chemical dependency, human services. We have a lot of folks doing that. And, they start with us as entry-level counselors, and they're going to school at JCC. So they really get hands-on experience while learning in school. We have licensed social workers, which you have to go for your master's program. So those salaries start around 40,000. Much more schooling, but again, it's you go for your master's for social work, or we have mental health counselors, that sort of thing. So that sort of gives you guys an idea, what our typical salaries. Like I said, just to wrap it up, we at CRADO, we partner with a lot of different nonprofits here around the North Country, and we love to be a part of this community. So if you're thinking about anything about this field, if you have any questions about resources, about addiction in general, please reach out to me and I can connect you, if you're interested in learning anything further. So thank you for your time, and I appreciate it. Thank you.
Thanks, Danielle. That was great sharing. Looking see if I can find questions. I don't see any questions there. Looking in the chat. I don't think I see any chat there. I don't know. I'm not seeing Michelle Matthews here anywhere. Does anybody know if she got dropped from the presentation? I'm thinking maybe because she's not here that she's not. So I don't know. But thank you, everybody, for joining us. I guess that's it. Go enjoy the sweltering heat. Get in some water if you can. You guys have shared some neat stuff for us. I've got your contacts, so don't be surprised when I reach out and say, hey, come to Case Middle School and talk to my kids, because you got a lot of great information to share. All right.
Thank you.
Everybody have a great afternoon. Thanks for sharing with us.
Thank you.
Thanks, Mark.
Bye, everyone.
Oh my goodness, what a circus I am. Oh, jeepers. Yep, not as much as me, thanks. All right, now how do I? I think I'm ending the event.